Today we are going to talk about heart failure. Heart failure is a condition in which the heart cannot pump adequate blood to meet the normal metabolic body demands. This happens because there is a disease that is affecting the heart, making it incapable of meeting the daily metabolic needs of the body. There are times that the heart is not able to pump adequate blood of what it's supposed to eject out, and we call this heart failure with decreased ejection fraction. And then there is also situations where the heart is not able, it pumps out adequate blood, but the blood that comes into the heart is inadequate, so that even when it is pumped out, it does not meet the metabolic demands of the body. And this is heart failure with the normal ejection fraction. So what are the main causes of heart failure? One of the diseases that affect the heart is the diseases of the heart valves. There are various valves. In the valve, you have the mitral valve, the tricuspid valve, the aortic valve, and the pulmonary valve. And these ones can narrow, what we call stenosis, or they can inadequately close, what we call regurgitations. Then you have problems with the heart rhythms, where we have abnormal heart rhythms, what we call arrhythmias, condition like atrial fibrillation. Then coronary artery disease, where there is inadequate supply of blood to the heart, leading to myocardial infarctions. Then you have some people with familial diseases affecting the heart muscle, where the heart muscle becomes thicker and hypertrophied, leading to inadequate filling of the heart. Then uncontrolled hypertension leads to increase in heart muscle, and this would lead to coronary artery diseases. Then we have excessive use of recreational drugs like cocaine, excess use of alcohol, leading to condition we call cardiomyopathy, and also some infections to the heart, like we have streptococcal infection leading to valvular diseases. We can also have viral infections leading to heart muscle diseases, a condition called myocarditis, which is infection of the heart muscle. So what are the symptoms of heart failure? Patients will present with swelling. The swelling could be on the face, the hands. If they have been standing, there will be swelling on the legs. And if a patient has been lying most of the time, then there will be swelling over the lower back region. Then there would be, because of the increased fluid volume in the body, then patients will tend to increase in weight. They may also have increase in the abdominal diameter because of the increased fluid overload. Then when you look at the veins in the neck, what we call the jugular pressure, the jugular vein, there is increased pressure, so that there is an enlargement of the jugular veins. Because of the inadequate supply of oxygen, then the patients are lethargic, they are tired, they may be anorexic, and they may have poor appetite. They may have an irregular heart rate. There could be increased passing of urine at night. Then they may have difficulty in breathing. They may have difficulties with the oxygen, especially when they lie down. They may awake at night because of lack of inadequate oxygen, something we call paroxysmal nocturnal dyspnea. They may have a cough, which is usually at night or on lying down, and then there is excessive weight gain because of the accumulation of fluid. So usually many of the people will have normal cardiac functioning, but they may have triggers which will push them to decompensate. And this includes if they are taking excess fluids, if they have any infection like lung infection or generalized infection, abnormal heart rhythms or what we call arrhythmias, if they get kidney diseases or anything that will make them retain more water, coronary artery diseases leading to myocardial infarction. We have inadequate reduction of the medication, those who are on drugs. If they, for any reason, they stop their medications, then that would lead to heart failure. Then there are also some drugs that patients can take, especially drugs like steroids, drugs like prednisone, drugs we call NSAID like brufen, diclofenac, which can make patients retain more water, and that can trigger them into heart failure. Then we have the pulmonary embolism, where we have formation of clots in the lungs, which usually would start possibly in the lower limbs, and then they end up in the lung, making the exchange of oxygen and the pumping work of the heart more harder. Then there are conditions or situations where there is increased metabolic needs in the body, like patients who have thyroid diseases, pregnancy, and if patients become anemic. So those are some of the triggers that will make patients who have been okay to get decompensated. Then you have complications of heart failure include you can have renal failure because the body compensates with inadequate supply of blood to the kidneys. You can have electrolyte imbalances. It can affect sodium. It can affect potassium and other body electrolytes. You can have, because of the congestion, you can have impaired liver functioning. Patients who have heart failure, they are at increased risk of getting clots, and also may also have arrhythmias or abnormal heart rhythms. So how do we manage heart failure? One is to regulate the use of fluids. You want to decrease the amount of fluid that patients are using per day because they don't have the capacity to eliminate them. Usually we advise patients to restrict their fluid intake to about 1.5 to 2 liters in a day. Decrease the use of salt, especially high salt foods, and also decrease the amount of salt that they add, especially the salt we add at the table. Reduction in alcohol intake if they are taking alcohol. Of course, elimination of smoking for those who smoke. And then also exercises, especially as the body can tolerate. And then there is the use of drugs. There are various drugs that are used in the treatment of heart failure. We have drugs we call diuretics. We have drugs we call AC inhibitors. We have beta blockers, and the other groups of drugs that can be used. So the most important thing is when patients have the symptoms is to present to the healthcare facilities, and then diagnosis can be done, and they can be put on treatment, and then they can also be trained on the behavior modifications so that they can improve the functioning of their hearts, and those conditions that can be treated should be treated so that they are able to go and live their normal everyday life. So thank you very much. We encourage you to subscribe to our YouTube channel. Give us your comments. Also, we ask you to also recommend our YouTube to friends and colleagues so that we also continue learning together and maintaining our health. Thank you very much for listening to me.